Hi everyone, welcome back to my YouTube channel, and today we are going to talk about granulomatous inflammation. So let's start our topic with introduction. Granulomatous inflammation is a distinctive type of chronic inflammation characterized by formation of granulomas. A granuloma is a small organized collection of macrophages that is often surrounded by lymphocytes and sometimes by multinucleated giant cells. It represents the body attempt to wall off substances it perceives as a foreign but cannot eliminate. Definition: Granulomatous inflammation is defined as a chronic inflammatory response in which activated macrophages aggregate and transform into epithelial cells, often accompanied by giant cells and a rim of lymphocytes. Causes of granulomatous inflammation include infectious agents like Mycobacterium tuberculosis, fungi, and parasites, and there are non-infectious agents that can also cause granulomatous inflammation like foreign bodies, autoimmune diseases like sarcoidosis and Crohn's disease, and there are also unknown causes that are idiopathic conditions like sarcoidosis. Pathogenesis of granulomatous inflammation. The process begins when macrophage ingests a persistent antigen but fail to degrade it. This leads to continuous immune activation, recruitment of T lymphocytes, and transformation of macrophages into epithelial cells and giant cells forming granulomas. Morphology of granulomas. Granuloma typically consists of central epithelial macrophages, multinucleated giant cells like Langerhans or foreign body type, surrounding lymphocytes and fibroblasts, and there is necrosis, that is in the case of casseting granulomas in tuberculosis. Types of granuloma. First is casseting granuloma, that is seen in tuberculosis with central necrosis. Second is non-casseting granuloma, that is seen in sarcoidosis like in Crohn's disease. Third is foreign body granulomas, that is formed around exogenous materials like sutures or splinters. Clinical examination. Examples of granulomatous inflammation include tuberculosis that has classic casseting granuloma with central necrosis. Second example is sarcoidosis that has non-casseting granulomas in lung and lymph nodes. Third example is leprosy that are granulomas in skin and nerves. Fourth example is Crohn's disease, that is granulomas in intestinal wall. Diagnostic method of granulomatous inflammation. Histopathological examination of biopsy sample is done for diagnosis. We can also do special stains like Zeals-Nelson for tuberculosis and PAS for fungi. Imaging studies for systemic involvement may also be helpful, and laboratory tests to identify underlying cause is done for diagnosis of granulomatous inflammation. Significance of granulomatous inflammation. First, it indicates chronic disease. It helps differentiate between infectious and non-infectious causes. It guides treatment strategies like antibodies, antifungals, and immunosuppressants. Conclusion of this lecture video. Granulomatous inflammation is a specialized immune response to persistent stimuli. Recognizing its features and causes is crucial for diagnosis and management of chronic infectious and autoimmune diseases. And this was all about granulomatous inflammation. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.